So I've attached a couple of Therabands with handles to this treatment table, and we're going to start with two very basic exercises for the posterior portion of the rotator cuff, the infraspinatus and teres minor. The first is called the walkout exercise. The walkout exercise is designed to facilitate isometric contraction of the posterior portion of the cuff. Building isometric strength is very important and sometimes necessary before you even start with isotonic muscular contraction. The isometric walkout for the posterior portion of the cuff looks like this. We have the patient elevate their arm maybe 30 degrees in the plane of the scapula. We make sure that the arm is detached away from the body in a slightly internally rotated position. This is a position of stability for the glenohumeral joint and also tends to keep the head of the humerus well centered in the socket. Now, the isometric walkout for the posterior portion of the cuff is just like this. We have the patient hold that position where there's tension on the band for 6 to 10 seconds, and then step back in. Now there's very little tension on the band and very little isometric contraction of the external rotators. Step back out, and now my external rotators are working pretty hard to maintain this static position of the arm. Now we're on a rest period, and now we're on a strengthening period. Once we've built the platform of isometric strength for the posterior portion of the cuff, we can have our patient work on eccentric training of the posterior portion of the cuff. Or shift between concentric and slow eccentric returns. Concentric, slow eccentric returns. We've chosen red because oftentimes it's red or yellow Theraband that you're going to be selecting to strengthen the posterior portion of the cuff initially when there's a weakness impairment.